Tanigo is a suction mirror retraction system that provides dental clinics with a streamlined workflow solution. The system is designed to help solo practitioners perform effective treatments while saving clinic time, effort, and costs, and ensuring patient safety and comfort. By combining the three functions in one device, Tanigo makes two-hand and two-instrument procedures possible, mainly for dental school students, hygienists, and dentists who work without a chairside assistant. The Tanigo body is made of very smooth and light plastic and holds a light anti-fog mirror film. Tanigo has 8 front, back, and surrounding suction intakes designed to draw away liquids from the mirror and any treated area in the mouth while enabling liquid-free retraction. Tanigo is connected to the suction tube that serves as its handle, liquid carrier, and a means of connecting it to the dentist chair. To support the special needs of single practitioner treatments, Tanigo is connected to the saliva ejector hose to allow for a light and easy grip when maneuvering it in the patient's mouth. The saliva ejector itself is therefore connected to the HVS hose to maintain its sucking purpose. First step: connect Tanigo to a suction tube. Then connect the suction tube to the blue adapter. And then connect the blue adapter to the saliva ejector hose. Second step, connect the saliva ejector to the white narrow adapter. Then connect the white narrow adapter to the HVS hose. When needing to remove large particles or excess liquids from the patient's mouth, the system provides additional suction capabilities for substances that are too big for Tanigo's intakes. When needing to remove excess liquids accumulated in the lower cavity, the user may temporarily move Tanigo away from the treatment area to clear the liquids and then continue with the treatment. This method is useful mainly for cleaning and preventive procedures in a non-liquid saturated environment. It also allows the practitioner to avoid using the saliva ejector entirely for the sake of the patient's comfort. When needing to remove large particles and other substances accumulated in the mouth, the user may temporarily disconnect Tanigo from its tube to remove the accumulated substances with the bare side of the suction tube, then reconnect Tanigo to the tube and continue the procedure. Both methods are useful when operating in any of the upper or lower mouth cavities. However, when operating in the upper buccal and palatal areas, using the saliva ejector is highly recommended. In cases where the dentist chooses to use Tanigo while having the suction tube and saliva ejector in their usual places, all that needs to be done is to attach the Tanigo to the suction tube already connected to the HVS hose. The method of detaching Tanigo from its suction tube to suck away excess substances applies to this method as well. This method is less recommended for longer procedures, as the weight of the hose may make maneuvering Tanigo more tiring. Tanigo is a disposable and recyclable device and is to be disposed of after each treatment.